Hi, I'm Carley Tatum.
And I'm Polk. And today we're going to be discussing current evidence-based practices for the treatment of breast cancer. So first we're going to talk about breast cancer. Breast cancer is a disease in which malignant cells form in the tissues of the breast. They begin as single transformed cells that grows and multiplies and is distinctly different from the parent tissue. Breast cancer has many different clinical presentations. Early forms responds to different treatments. Each form, responds to different treatments. Early detection is key to survival, and nurses can play a key role in early detection and education. Next, we want to talk about the clinical manifestations of breast cancer. Breast cancer has many forms with different clinical manifestations. Some breast cancers are palpable, and some only show up on the mammogram. Palpable breast cancers will be defined by the presence of non-tender, fixed, hard mass with irregular borders. These masses are most common in the upper outer quadrant. Also, they may have some signs of pitting edema, nipple retraction, and an orange coloration around their breasts. Some risk factors that we would like to discuss for breast cancer. The first would be being female gender. The second would be age, older than 50 years of age, early menarche, also late menopause, the history of having a previous breast cancer, nulliparity, the first birth after age 30, inherited mutations of the BRCA1 and BRCA2 gene, also the use of hormone replacement and oral contraceptives. In addition, exposure to radiation, obesity, and having a first-degree relative of breast cancer, such as your mother, sister, or your daughter.
Okay, the next thing we want to talk about is some prevention strategies of breast cancer. So the first one is breast self-exam, and this you should begin for women in their early 20s. It should be done 5 to 7 days after the first day of a woman's menstrual cycle when the breasts are not tender or swollen. It can be done using the vertical, radial, or spiral method. And the nurse should focus less on the specific technique used and more on promoting overall breast awareness. In addition, it's important to be aware of any changes that you may need to bring to the healthcare provider's attention. The breast self-exam should be done monthly along with annual clinical breast exams and periodic mammograms depending on the woman's age. So for mammograms, currently the American Chemical Society recommends that these be done annually beginning at age 40, along with a clinical breast exam. Those individuals that have a high risk of breast cancer development should practice close surveillance by having an MRI screening along with their annual mammogram beginning at the age of 25. In addition, chemopreventative medications such as tamoxifen and raloxifene are currently recommended by the FDA for the prevention of breast cancer development in high-risk women. The nurse should discuss with the woman all of the risk, benefits, and possible side effects prior to initiating medication therapy. So based on our research of the current evidence-based treatment options, we found chemotherapy to be one of the top treatments. So chemotherapy agents are vesicants that can cause tissue damage, and they're given through a central line to prevent extravasation. This therapy has the advantage of downstaging or shrinking the cancer, which may allow for the switch from a mastectomy to actual conservation of breast tissue. If surgery is needed, chemotherapy can be used after the surgery and prior to radiation therapy to prevent a recurrence of breast cancer. Some common side effects of undergoing chemotherapy treatment are nausea, vomiting, bone marrow suppression, taste changes, alopecia, mucositis, neuropathy, some skin changes, fatigue, and weight gain. And then some nursing interventions that we can do are some ongoing assessments of fluid and electrolyte status, and this is related to the anorexia, nausea, vomiting, altered taste, mucositis, and diarrhea. The nurse can identify different ways to encourage adequate fluid and dietary intake, and also encourage the use of antiemetics like Zofran for nausea and vomiting. Also, assessment of infection and bleeding is important, related to the suppression of the bone marrow and the immune system. So for this, the nurse can promote proper hand hygiene to prevent infection, as well as monitored for an increased white blood cell count and a temperature. Also, monitoring for extravasation And this would be done by assessing for burning, pain, redness, or swelling at the IV site. Additionally, you can maintain safety when handling the chemotherapy agents by using a double layer of gloves and a long sleeve disposable gown when handling the agents. The nurse should also dispose of any contaminated linens or syringes and tubing in a leak-proof container labeled as hazardous. Lastly, the nurse can protect the caregivers and the family on safe and proper handling of chemotherapeutic agents if treatment is going to be administered in the patient's home.
The next evidence-based treatment option that we found is radiation therapy. Radiation therapy is used to decrease the chance of a local recurrence in the breast by eradicating the microscopic cancer cells that remain in the breast. There are two common forms of radiation. One is your external beam radiation and one is your brachytherapy. The first one, the external beam radiation, is a method for delivering several beams of high energy x-rays to a patient's tumor in order to destroy the cancer cells. The beams are generated outside of the patient's body, aiming at the targeted tumor site. The goal of this treatment option is to remove, shrink, or prevent the tumor from reoccurring. The next form of radiation is brachytherapy. Now, this form of radiation is an internal radiation. This treatment allows radioactive seeds to be placed into a device that is placed inside the breast tissue. Treatments are typically done 5 days a week as an outpatient. So with this, some nursing interventions and teachings that we would like to discuss. One would be prior to the start of external beam radiation, the treatment team will make a small skin marking on the patient's skin, and this is used as a guide to focus the radiation to the targeted area. We want to instruct the client to avoid rubbing the skin marker and avoid using harsh lotions or creams on the targeted site. We want to advise the client to avoid bras with underwire, nylon, or lace. Evidence-based practice recommended the use of a breathable cotton bra or camisole. Also, the patient should remain on bed rest if they are doing brachytherapy during the treatment in order to prevent dislodgement of the radiation. And as a nurse, the nurse should wear a dosimeter device, and this allows the nurse to monitor the amount of radiation that they are being exposed to. The next form of treatment for breast cancer is a modified radical mastectomy. For the modified radical mastectomy, this involves removal of both breast tissue and lymph nodes. So some post-operative care for a patient who has just underwent a modified radical mastectomy. We want to elevate the affected side of the with the arm slightly above the heart. We also want to avoid taking blood pressure measurements, injections, or venipunctures on the affected side. We want to watch for signs and symptoms of edema of the affected arm. Lymphedema can occur at any time after an axillary node dissection. We want to do some range of motion exercises such as flexion and extension of the hand during recovery. We also want to assess the dressing for drainage, and we want to report any excessive drainage to the healthcare provider. We also would like to provide privacy when the patient looks at their incision. And next we would like to talk about some common nursing diagnoses related to breast cancer. And here are our nursing diagnoses. One would be impaired oral mucosa. We want to encourage frequent oral mouth care, impaired tissue integrity, imbalanced nutrition. So we want to promote high protein diet, chronic pain, fatigue, and disturbed body image. Also anticipatory grief, so prior to their mastectomy, we just want to do some patient teaching and teach the patient of what to expect after the recovery. And they also are at risk for infection. And this concludes our presentation on breast cancer.
Thank you.